Hello, I'm about to present to you the Timed Up and Go test. This presentation was developed by Morgan Madonna, Anthony Gill, Mariama Jallo, Melanie Bennett, and myself, Elise Stanislav. Timed Up and Go test, we're going to talk about falls first. So, each year, millions of older people 65 years and older fall, but less than half of them are going to tell their doctor. Falling once will double your chances of falling again. 1 out of 3 people will fall each year, and 1 out of 5 falls cause serious injury like brain injury or hip fractures. 2.5 million older people are treated in the emergency department for falls each year. Over 700,000 patients a year are hospitalized because of this fall injury, most often because of the head injury and hip fracture. More than 95% of hip fractures are caused by falling, usually by falling sideways. Falls are the most common cause of TBI. Falls can not only cause head injury and broken hips, but other broken bones, and also establish a fear of falling again. Some risk factors include lower body weakness, vitamin D deficiency, difficulty with walking and balance, vision problems, and any hazardous things in the way of their environment. Poor footwear or foot pain can also contribute to falls.
And now I'll talk to you about what is Timed Up and Go, better yet known as TUG. Timed Up and Go is a simple, widely used performance-based measure of lower extremity function, mobility, and fall risk. The TUG test is used to assess walking speed, dynamic balance, and individuals' risk of falling, using an objective timing measure. The Timed Up and Go test is frequently used to test elderly individuals ages 65 and up.
Some of the equipment that is needed for the test is a stopwatch to time the client when they walk, a sturdy chair with armrests, and a tape or a cone to mark where the client is going to walk to. Some of the directions for the patient is you have to make sure that they're wearing the proper type of shoe. The client has to be sitting in the armchair. If they need any assistive devices to help them with walking, we keep those close by to them. The clinician will demonstrate the test to the client, and then we will have the client run through it before we actually time them. So for the instructions, the clinician will say go, and when they say go, the client will stand up from the chair, and then they will walk on the floor at a normal pace to the line or the cone, and then they will turn around the cone or the line, and then they will walk back to their chair at a normal, comfortable pace that's safe for them. And the last step is they will sit down slowly into the chair.
I will now read you the results of the TUG test. If an older adult takes greater or equal to 12 seconds, they are at great risk for fall. So anything higher than 12 is at risk for fall. Anything lower than 12 seconds is not at risk for fall. Observations. Slow tentative pace, so the patient must walk slow at a regular pace. Loss of balance, short strides, little or no arm swing, steady self on walls, shuffling and block turning, not using assistive device properly. Validity and reliability. The TUG test has an excellent test-retest reliability in Alzheimer's patients, osteoarthritis patients, Parkinson's disease patients, stroke patients, community-dwelling elderly adults. The TUG test also has an adequate test-retest, but reliability in elderly adults who are cognitively impaired, individuals who have suffered from TBI. For validity, there is an excellent correlation between the TUG and bar balance test, TUG and gait speed, TUG and Barthel index of ADL, and TUG and functional gait. Assessment in elderly adults. The TUG test was able to predict fall risk. So 56% of sensitivity and about 60% specificity.
So some pros and cons of the TUG test. It is very inexpensive. You really don't need much equipment. If you don't have a cone, you can use tape, you can use a marker, just anything that can show where the client should be walking to, so you don't really have to spend much money. Your timer, it comes from your phone, it can come from a watch. You don't necessarily have to buy like the nicest timer. And then of course having a chair, so you really don't need much equipment. It's very cost effective, and it should only take about 3 minutes total with going through instructions and then having the client actually perform the test. Additionally, it is also valid and reliable, as Mariama just put. Some cons, so depending on the client, some assistive devices can actually hinder the performance. Anything that goes in the way, which is why it's really important that you they perform the test in a safe area with space for the client to walk. So any cognitive delays can also inhibit performance. So if you have a client who has a TBI and you want to perform this test to see if they're at risk for falls, sometimes depending on the day or depending on what type of medication they have taken, their cognition can kind of impair the results of the test. So that's not really ideal for the TUG test results.
Although the TUG test is appropriate in some cases, there are some cases when the TUG test should not be used. One is if the patient is cognitively impaired. So the patient cannot follow simple directions, or due to short memory, or they cannot retain directions, then the TUG test is not appropriate. Another is if the patient is at risk for falls. So if the patient cannot walk at least 3 meters, the test is not appropriate. And if the patient is at risk at fall, they're also not safe. So therefore the test should not be appropriate for that patient.
So evidence-based practice in which the TUG test was used was in an article called "The Risk of Falling Among Elderly Persons Living in the Community Assessment by the Timed Up and Go Test." And this test was based on 102 individuals in a geriatric ward. And first the test started, they were interviewed about their diagnosis. So individuals who were diagnosed with Parkinson's 4 disease were not used in this test. And other individuals reported diseases and complaints such as diabetes, high blood pressure, dizziness, stroke, high cholesterol, and heart disease. So the method of this experiment included individuals being tested from being seated to standing up and walking in a straight line to a marker which was 3 meters from the chair. They then had to turn around and sit in the armchair again, like as we all explained how the original TUG test was performed. So the results concluded times that were less than 10 seconds were classified as individuals who were fully independent. Times between 10 to 19 seconds are also independent, but the individuals have reasonable gait speed. Times between 20 to 29 seconds concluded that the individuals were classified as having difficulties in their activities and were less independent. And time spent on a TUG test, which was greater than 30 seconds, concluded that individuals were highly dependent on others. So compared to the other tests, like the Berg test, results can conclude that the TUG test is a great tool to use to assess the risk of falls and to assess the independence of individuals.
TUG test and OT. OT interventions include working on balance and endurance, which are essential for safely performing ADLs. OTs use the TUG test to assess the client's mobility and risk of falling based on the results of the test. An OT can make recommendations or modifications for walking aids if needed. And this concludes our presentation on the Timed Up and Go test, also known as TUG. Next will be our video demonstration. Please enjoy.
Hello, I am Anthony Gill and I am an OT student at Howard University. Today I will be teaching you the proper setup for the time up and go test and the objects used. So for the chair placement, it should be free from any obstacles, and your marker, which can be a cone or tape or any type of object, should be placed approximately 10 feet from the chair. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And next, we should always have our timer to time the patient. So next, we will demonstrate this whole procedure.
Now we will give instruction on how to demonstrate the timed up and go test. Begin the test with the subject sitting correctly in a chair with armrests. The chair should be stable and positioned such that it will not move when the subject moves from sit to stand. The subject is allowed to use the armrest during the sit to stand process. On the word go, you will stand up, walk to the line on the floor, turn around, and walk back to the chair. You will sit down and walk at your regular pace. The clinician will start timing on the word go and stop timing when the subject is seated again correctly in the chair with their back resting on the back of the chair. The subject should wear their regular and normal footwear. Normal, healthy elderlies usually complete the task in 10 seconds or less. The subject should be given a practice trial that is not timed before testing. And this is how you conduct the timed up and go test.
How are you today?
I'm good. How are you?
I'm fine, thank you. I'm Mariama and I'll be your occupational therapy today. And today I'm going to be assessing you while you do the time up and go test. But first, I'm going to demonstrate it for you. And then you're going to do a pre-run, and then we'll do a final walkthrough with me timing you.
Okay.
Sounds good?
Yep.
All right, so first I'm going to demonstrate.
Okay.
Just watch, okay? All right, so first step, sitting on the chair, my back rested properly, just normal. All right, and then I'm just going to get up using my armrest, and I will walk to the cone, turn around, walk back to the chair, using the armrest. I'm going to sit back down, making sure my back is resting, just sitting normal.
Okay.
All right, looks good?
Mm-hmm.
Think you can do that?
I think so.
Perfect. All right, let's see you do it. All right. And just walk your normal pace.
Okay.
Good. How did that feel?
Good.
Good? All right, next, Mrs. Madonna, we're gonna try it with me timing you.
Okay.
Okay?
Mhm.
So just one more time, I want you to do the same thing, and this time I'm gonna time it.
Okay.
All right, when you're ready. All right, good. That was about 10.6 seconds. Not bad. Good job.
Thank you.